Hello everybody, we're going to continue now with, we're still covering the cranial bone, the skull bones. We're actually moving away from the cranial bones and on to the facial bones. So if you're following along with the study guide, believe it or not, there are 14 different facial bones. Some of them are very small and kind of hidden. And so we'll talk about those and the features there that are listed on the study guide for facial bones. First one, the maxilla. So you have two of those. You actually have a left and a right maxilla. And so here they are, left and right. They are actually two different bones, which means as you're studying the physiology for this unit, Unit 3, that means that they begin to develop in the fetal skull from separate ossification centers, where you have this connective tissue that forms first, and kind of in the center of it, it begins to ossify and convert over to osseous tissue. So the reason why you end up with two different maxillary bones, that's another way you can refer to the maxillae, is that they begin to ossify from separate centers, and then they form joints that are suture-like and never come together as one distinct bone. All right, let's see here. Okay, so your left and right, let me just keep one highlighted, the right one. I'm going to rotate it around so you can see it's a pretty complicated bone in terms of its shape. You know, up here the superior portion of the bone is actually forming the floor, most of the floor of the orbital cavity. So you can see it's got a pretty complex shape. You can rotate it around this way and you can actually see where it's located on that part of the skull as well. Okay, so how about the features that we have here? Now the first one on your list, alveolar process. What we need to do, I'm going to select both of the maxillary bones at the same time, and the alveolar process is actually formed from the left and the right maxilla together. So this whole curved surface that you have right there that the teeth are embedded into, that's your alveolar process. Alveolar, something that has like a curved shape like that can be called alveolar. In your lungs you have alveoli or alveoli. Those are the air sacs that have a curved shape to them. So you'll see that term used every once in a while in anatomy and physiology as well as other biology courses. All right, so that's your alveolar process, that whole section right there, and it is actually formed from both the left and the right maxilla together. I'm going to skip palatine process for a minute. The next one I want to do the infraorbital foramen. So you have a left and a right. There's one right there, and there's one right there. Each of those is an infraorbital foramen. Now those you can figure out by the name. Infra sounds like inferior, orbital referring to your orbital cavity. So those are located inferior to the orbital cavities. And again, when you have foramina, those are passageways for blood vessels and nerves that are moving, you know, from the cranium inside the skull outward towards, you know, the muscles and skin and other tissues of the face. You could also have some lymphatic vessels passing through there as well. Maxillary sinuses, let's go ahead and do those as well. Kind of like for the other bones, the left and right maxilla are pretty thick right in here. And if you were able to grasp that with your thumb and your index finger on a real skull, you would certainly appreciate that. And so inside there are membrane-lined, epithelial membrane-lined compartments, which are your maxillary sinuses. So you have those on each side as well. And again, sinuses are not too hard. If I have an arrow pointing to the left maxilla and I say, what space is located in here? It would be the left maxillary sinus. So sinuses are pretty easy as long as you know your bone names. All right, and finally the palatine process. Let me get out of my pen here for a second. What I'm going to do is, let me deselect the left and the right maxilla. I'm going to highlight the mandible. That's the lower jawbone. I'm going to hide that. And actually, let me get rid of these teeth. We're going to pull this guy's teeth out really quickly here. make those go away. All right, I'm going to rotate this upward like that. I'm going to move it down like this. Okay, so right there and right there on both the left side and the right side. That's a portion of the left and the right maxilla, and it forms the hard palate in the roof of your mouth. Hard palate means that you have bone underlying that part of the palate. And so that is actually called the palatine process. Not Palestine, palatine for hard palate. And that's actually a feature that is composed of part of the left maxilla and the right maxilla where they come together. So that's pretty straightforward. And actually, while we are looking at this, let me deselect those. I'm going to skip down your study guide there all the way down to the palatine bones. You have 2 of those. All right, so you can kind of see on here the palatine processes, it's one process made from portions of the left and the right maxilla. That makes up most of the hard palate in the roof of your mouth. But then you got a little bit right here and a little bit right there. So that is the inferior portion, the bottom portion of 2 bones that are called your palatine bones. So they make up the rest of the hard palate. But it just turns out, you know, when your skull is developing in the womb. And let me highlight those bones again for you. And I'm going to rotate this skull upward. And what you'll see is these bones actually have an L shape to them. Actually, let me deselect. Let me get rid of the left and the right maxilla for a second. All right, so I stripped those off, and I'm highlighting your left and your right palatine bones now. Oops, hang on, I highlighted something I didn't want to highlight. There we go. So you can kind of see how they're L-shaped. So the bottom part of the L is actually forming that posterior portion of the hard palate, and then the sides are forming part of the lateral walls of the nasal cavity. So they are actually kind of L-shaped. Let me rotate them around. You can see that view, and you can see that view over there as well. And then this is what we were looking at before right here. You were looking at the inferior portion, the bottom portion of those 2 bones. All right, so that's those 2. Those are not too hard. Now let's, all right, let me bring everything back. I'll refresh my view. There we go. Now we're going to move on to the mandible. The mandible is the lower jawbone. Now, in contrast to the maxillary bones, this is just one bone. So it forms from one ossification center as the fetal skull is developing. And you can rotate it around, and you can see where the mandible is located there. Now what I'm going to do, I'm actually going to hide everybody else here, hide others, and we're just going to take a look at the mandible and the features that it has. So if we go through our list here, all right, the body of the mandible. The body of the mandible is simply this main portion of the mandible. As I rotate it around, there's part of the body over here. All right, and then the angles of the mandible. So you have an angle on the left. This is the angle on the left. This is the angle over on the right. And you've probably heard about the angle of the jaw before. And so that's actually part of the mandible. Mandibular condyles. All right, so we talked about those before when we were taking a look at the temporomandibular joint, because the mandibular condyles, those rocker-like features on the mandible, articulate or form a joint with the mandibular fossae that are located on your temporal bones. And if that doesn't sound familiar to you, you may want to go back and review the video lecture clip where we were talking about the temporal bones. All right, so let me rotate this around. Oh, interestingly, you know, I think maybe that's the first time I've brought up that word articulate. I probably should have brought that up sooner and should have been using it. Articulate, if 2 bones articulate, they form a joint. Joint articulation, articulation between bones. That's where 2 bones come together. That's what that term means. All right, so your mandibular condyle, so right there and right over here. So again, that's the portion that forms, that articulates with the mandibular fossa of each of your temporal bones. And we took a look at that on that other video clip, so I'm not going to bring that up again here. Coronoid processes. Okay, so a process on a bone is going to be like a projection, a part that sticks out. And so I'm here over on the left side. You got this pointy process here, pointy process over here. Those are called the coronoid processes, and notice how they're kind of triangular shape. Some people remember that by like you coronate a king or a queen, you crown them, and those kind of look like the points on a crown. So that could be a good way to remember that. Okay, alveolar process. So on the mandible, you also have an alveolar process right here, which the lower teeth are embedded into. And so you've got an alveolar process up here that's formed between the two maxillary bones, and then the one in your jaw is part of the mandible. All right, number 6 there on the list, the mandibular foramina. So you have a mandibular foramen on each side. Let me rotate this around. So we've got this view here. I'm going to zoom in. Notice how you've got a hole right there. Yeah, I can actually highlight that on visible body. Right there, that's the mandibular foramen on the right. Rotate this guy around, mandibular foramen over on the left. So that's just an opening on this posterior lateral portion of the mandible. And interestingly, all right, so you got that hole there. So we said that foramina were openings for blood vessels and nerves. And so blood vessels and nerves enter that hole there, and they actually pass through a tunnel on the inside of the mandible here. And then they exit through, you've got a hole there and a hole there. Each of those is called the mental foramen. So you've got a left mental foramen and you have a right mental foramen. Remember, the mental region refers to the chin. So they actually tunnel through the bone and then come out through those openings there. Also, while they're tunneling through the bone inside here, they send out little extensions. You have smaller blood vessels and smaller nerve fibers that extend up to your teeth. So that's how your teeth get their, and the gum line there, get their blood supply and also have their nerve supply that they need. All right, so that concludes the maxilla and the mandible, and I think I'm going to stop this particular video clip here, and then I will finish up the remaining facial bones on the next video clip.